What do you mean by tuck tail?
right? Um, really, a posterior pelvic tilt, but it can't be a sheer forward, right? And that's what I mean. Like, I've already taught them how to do that, usually by like the wall exercise, or I've propped them into a posterior pelvic tilt on the floor, so they know how to relax their back, because a pelvic tilt or a tail tuck should actually relax your back, and it should relax your abs, right?
So
Um,
when you get the tilt right, what exactly should that look like? Like what should they say
yeah.
you have them in like a hook lying position and you ask them to pelvic tilt, what muscles usually do people feel and what should that look like in terms of like your ab area?
Well, and I've been working on this a little bit, because okay, for sure they should not have any abdominal activity with it. That's a huge one, because and that's a sheer forward. If they're yanking up with their abs, and then what happens is their back contracts too. So what I'll always do is I'll put my hand under their back, but that's not always a sure win, because they'll drive into the ground, and actually those are the people who a pelvic tilt will hurt their back, because they're just using their back to um to force themselves down, force their back down into the ground. um so you again, it goes back to like less words. I'll If I find that that's what they're doing, I put a if I can't say, like, just tilt your pelvis and let your back relax and your belly relax, if that doesn't work, and it almost never works. If they're in there, if they're seeing me, I don't care what they're seeing me for, it doesn't work. So I give them like either a wedge under their pelvic floor, or towels, because I want them to be able to repeat it at home, right? Like, not everyone has like those awesome wedges, so I'll just put some towels under their back, or like along their pelvis. Depending on the person, I have to do that differently. And then I say, now relax your back into the ground. Just let it relax. And that pelvic, like, it just softens. So essentially it's a yielding strategy. It's not this like major motion that people want it to be. Yeah, I'll have them pull their heels back a little bit. So, depending on the person, I might give the cue, feel, feel the inside of your heels on the ground, gently pull back. But really, you should be able to be in hook lying and just relax your back down, and feel that pelvic floor, or that, sorry, not pelvic, the pelvis just rotate back into a rested posterior pelvic tilt. So that's uh that's kind of how I do it. It's not fancy. I don't do anything fancy. I try to, speak to my patients, and that sometimes probably gets me in trouble in, talks like these, but it's what my patients understand and how they do well and how they succeed. But yeah, I'm always looking and that they're not using a hip flexor strategy, right? So a lot of them will try to like push their legs away, gets those abs involved, and the back involved. So I try to make sure none of that's happening. And then when I get them there, then now they actually have access to, then I'm gonna say, exhale, feel your belly drop down as you exhale. Um, and then make sure it doesn't, don't, I said, if your belly starts to push up, that's it. That's all you have. So that's a big thing for me that I use a lot. That's it. That's all you have. um I always give the analogy of, if you're running a race and it's a team race and you have to all come in at the same time, do you run as fast as the fastest runner or the slowest runner? So it really gives them an idea that we're working on the bittiest bit, because people want big feels. And so taking away the big feel mentality and saying, you're just going to feel a little bit of abs. I don't want you to feel a lot of abs. They start doing those big exhales. They start contracting their back to posture up, to get more air out. That's all compensatory breathing stuff. And I don't want that here. I want a little bit of deep abdominal, a little bit of TA that they start to feel with that exhale. That's it. And so that's super important because people blow past it all the time. People blow past their abs, they blow past their hamstrings. I mean, they just want more glutes. Um, and so it's all about the baby feels when you're talking about foundational movement. Now, I'm not talking about like performance, right? I work very heavily in wellness, like getting people's bodies functioning again.
And so what is just, again, creating like it just enough room or just enough movement? How does that create a yielding strategy in the pelvis, and why is that so important for the people you
Ooh,
work
that's a great question. Ooh, I love that question. Let me think so I can answer it well. Um, okay. So, um, when you have, so let's just say it's someone with a hypertonic pelvic floor. Their pelvic floor is really, really tight. Um, and so what happens is if I don't, um, I make sure, of course, I've set them up really, really well. Let's just say they're in a really supported position and I'm having them do the exhale. So and I'm making sure their belly's going down, that they're getting those deep, the deep abdominal muscles. Um, if if they blow past it, what they're doing is they're using so if they come out of that posterior pelvic tilt, they're starting to use their pelvic floor as a postural muscle, right? So they're trying to support themselves now with what they've been doing, and contracting that pelvic floor and pulling it back to try to do to try to manage the to try to manage the system, right? And so um, I don't let them get to that point because I'm asking, because so if the pelvic floor is yanking back like this and being used as a postural muscle, it now doesn't it's not useful as a diaphragm, right? Just like the diaphragm. Okay, right? Because we can if you're if you have an extension at your like kind of mid spine, right? Your diaphragm is kind of facing out like a clam. It's a postural muscle, right? And it can't be a breathing muscle, right? Or it's really, you can't really be doing two things at once, right? Yeah. Or it could cause a strain if you do. Okay. So um what I do is it's the same thing. So as that pelvic floor is pulled back and acting as a postural muscle, it can no longer do the job of kind of contracting up, right? So that's the big thing for them, is being able to take that pelvic floor out of the postural position in a relaxed way and helping them regain the idea of the pelvic floor as a breather, as a pressure manager, not so managing pressure, not holding my spine and my pelvis back in place. So that's like that's this kind of stuff that I'm doing. It's that subtle stuff of trying to reestablish proper motion.